So good morning, everybody. And again, I want to thank the frontline workers that are out there every day doing great things, extraordinary things, and especially all the hospitals. And not just the doctors and the nurses, the administrators that keep it functioning and moving forward, because, and all the, the janitors, everyone behind the scenes. There's a lot of people you don't see day in, day out. And at this point in time with this epidemic going on, it really makes you appreciate people that you didn't really think keep our society moving. So I want to say thank you to everyone. As of today, there's 962 positive cases, up 25 from yesterday. There's 917 people under mandatory quarantine. That's up by 105 from yesterday. But under precautionary quarantine, that's down by 12. We're at 23, so which is a good thing. And, listen, believe it or not, we're going into almost 8 weeks now of this. And it's still amazing to me, and the great job Dr. Whalen and her team do, and the EPI team. I was down there this morning talking to them. And it's amazing that people still have an issue being under quarantine. And people that are positive that are refusing to stay home. I mean, it's incredible. Are you reading what's going on around the world? Are you watching TV? Are you online? People, it's not about you. It's about the people around you. And it's 14 days. It's not the end of the world. 14 days to stay home and not spread this. And it's one of the things that we talked about. And I do want to thank Dr. Eliza and her staff for everything they're doing. And with the graphs that we got up and the website you can go to get up-to-date information, it's still alarming to me the 20 to 29-year-old racket of age group of people that have a higher rate than 60 to 69. With no signs and symptoms, and Dr. Whalen pointed out some good stuff yesterday. But the reality is you go out, you think you're healthy, and you're infecting everyone around you. And what's the answers? What is the answers at the end of the day? This is all new to everyone. How do you open up? How do you do this? You do it by relying on two great doctors like this to the left and right. This is how you get it done, by going to the experts in the field and them guiding us. And then looking at the economy. Nobody wants to keep businesses shut down. Nobody wants to keep people out of work. But you're doing it for the safety and welfare of everyone around you. And, I was just looking over in Italy. They're starting to try to open up slowly, and certain things won't open up again to June. And if you remember what Dr. Whalen said from the beginning, 8 weeks ago when we talked about this, you look at what's going on in Switzerland and Sweden and everywhere else, in Australia, and you start, Britain, what they're doing over there right now, what the Prime Minister's doing. It's a new world out there, people. Again, like we said, it's a marathon, not a sprint. Take your time, take a deep breath, and we'll get through this together. Some of the good stuff, we had 2,156 people complete quarantine. Out of that, 487 that were tested positive for the virus have recovered. There's 43 people hospitalized, with a hospitalization rate at 4.46%, down from yesterday. Unfortunately, we were at 6 in ICU yesterday. We're up to 10 today. We're up 4 new people in ICU. And, we continue to pray for the 36 families, and our condolences again go out to everyone that lost a loved one during this. We are aggressively testing through our mobile testing sites with Whitney Young. Today, we are in the city of Cohoes. We're at, I believe, 55 Mohawk Street in the city of Cohoes doing testing there today, and we're getting that out and done, and we're staying in the community to continue to look at the stats and statistics of what we're dealing with here in certain communities versus other communities. So I do want to say thank you to Whitney Young and Dr. Whalen and her team, because it is important for the data that we collect, and we look at how this is affecting certain groups of people. We can statistically look at it, part of our equity agenda here in the county, to look at it and figure out how we can have tangible results that we can try to fix certain things, and that will help us going into the future. So Liza, thank you for all that. Also, the Rite Aid is up and running, and that's area code, or for the mobile testing, I should say, is 465-4771, 465-4771. Our drive-through at Rite Aid, again, is running well, so please consider that too. The Rite Aid, go to the riteaid.com, as always, to figure that out and to get an appointment to get in there. Also, we know we have to get more testing out there. It's with Dr. Whalen and I have talked about, we have preached about for the last 7 weeks, and we have continued to work hard to get everyone testing, because the more testing we get done, the more results we get out, we can get people back to work. We can get people out of your house. So that's only going to be accomplished by working with everyone. And I do want to announce today, in a partnership with the Priority 1 Urgent Care in Guilderland and Hamilton Square next to Market 32, we are launching a new testing site with our good friend, our doctor here, to Ashley, why don't you talk about what you're going to be doing in the town of Guilderland?
Thank you, Mr. County Executive, and it is truly a privilege and honor to be with you today. I'm excited to share with you some information regarding our opportunities with testing within the town of Guilderland and the scope that we reach beyond that. You know, you and I last got together, I recall, around March 2nd during the town of the Guilderland Chamber of Commerce State of the Town meeting.
Yes.
And at that time, you and I talked about what was going on potentially with the outbreak of the epidemic. And I got to tell you, I don't know about you, but I kind of owe you an apology. I think some of the information I gave you at that time was not really on the mark in hindsight. But I got to tell you, that was about 6-7 weeks ago we met, and it feels like it's been about 7 years now.
It does. I'm like, is today Wednesday? Is today Tuesday? It does.
We've
feel
come
like
so far so fast, and you know, I was speaking with Commissioner Whalen prior to the start of the conference, and you know, we are learning this thing literally from the inside out. There's so much we have to learn and understand about this particular virus and the disease it causes, and it's so complicated and it's moving so fast, and we wish we had great answers, and the way we're going to get answers is by getting great data, and the way to get great data right now is to do testing. And we're listening to that mandate that's come from all levels of government, and we're responding to that. And as a community-based healthcare provider, we wanted to do our part to engage in that. We are a business that's located, we've only been in business now for almost not quite 13 months at this point. We chose to open up in the community, and where we located at Hamilton Square is particularly good because it accesses so many aspects of Albany County. We can reach people in the towns of New Scotland, in all of Guilderland, the towns of Burn, Knox, and Westerlo, through routes 155, 146, Route 20. We get to rural Schenectady County and northern Schoharie County as well. And we really appreciate having that kind of access and being able to present this program to folks. We're doing the nasopharyngeal swab testing. We've just started doing it now, rolling it out, so our staff members are trained. We're able to do this safely, quickly, competently, comfortably, and maintaining the strictest standards of cleanliness and sanitation within the facility for the safety of all parties concerned. So far, it's been going well. We're really appreciative of the fact that we can work with the county government to accomplish obtaining materials for testing, obtaining materials for personal protective equipment, and also undergoing proper fit testing so our staff members can safely perform these tests as well. At this point, it's just the program is in effect. It's just starting out. We hope to dramatically expand it. We are available to take care of people who are seen as patients. We don't have a walk-up, drive-up kind of a facility, as is more commonly seen in the county and state testing sites. For us to take care of somebody with testing, they have to come in with a physical complaint, be it a cough, a sore throat, a headache, something like that, where we would see them, register them as a patient, and then evaluate them and test them accordingly as part of that evaluation. We have a very low threshold for testing patients who come in to be seen. Specifically, the recently released guidelines that expanded the criteria for COVID testing. We've embraced that now really since the onset of the epidemic, because we feel like this is a very insidious, very difficult to rapidly and easily diagnose disease, and certainly we've seen a number of cases that have been on one end of the extreme, fairly serious sick people coming through, and then fairly subtle presentations who have tested positive ultimately. So it's concerning. We want to be part of this. Back on March 2nd, when we demonstrated the partnership between the private enterprise, such as small business, and government, such as the town and county municipal governments, back at the Chamber of Commerce meeting, we're doing that again now. We feel like this is really the key to this, to solving this problem, is by bringing all resources to bear in a collaborative, cooperative fashion, and you doing everything we can, pulling out all the stops to see what we can do to really mitigate the onset and the dissemination of this illness. In terms of what we do from an urgent care perspective, would you like me to speak a little bit about
please.
that? Or
No,
I don't
please.
want to
No.
take your time too much here, but
I'm not going to stop two doctors.
I get talking, I can't stop, I'm sorry. But, you know, urgent care is uniquely positioned in the community. In New York State right now, there's probably roughly 800 urgent care centers statewide. In Albany County alone, I should check, there's probably about 30 of them. There's a lot of them. But the good thing about that is it disseminates care to the community. You don't have to necessarily find your way to a large hospital facility downtown and whatnot. You can be out in the community where you live, where you work, and access a relatively sophisticated level of health care for when you are acutely sick or injured. You know, we're not primary care providers, we're not chronic or continuing care providers, we're acute care providers. We provide what we call on-demand health care. And in this case, we have people coming in who are saying to me, you know, I probably wouldn't have come in to be checked out because it's not really that much of a runny nose or a sore throat, but given what's going on, we feel like we should get it looked at. And I think it's a responsible approach for people who, you know, have complaints, who have symptoms, and who certainly can be sick with things other than COVID-19. We're intercepting a lot of folks coming through like we normally do, but maybe even more so in terms of acuity. People have held off seeking out routine health care, or they accessed other mechanisms of health care and haven't really been able to be evaluated as thoroughly or as fully as they might need to be to discern what's going wrong with them or what's going on with them. So we're ready. We want to be part of the solution. We're available. We committed as a small business that opened up not that long ago to be in business, to stay in business, and to provide as much access as we can. We want to keep all of our employees engaged and employed, obviously. We're not going anywhere. We're resolved to fight this thing through to the end. And that's you know, we think we have a good shot at doing that. And I think partnerships like we have with the municipal governments like Albany County are really going to help see us through in terms of that. So we thank you for that support.
Jonathan, thank you. And again, being part of the community, being part of the solution. And that's like, I can't begin to tell people the amount of citizens in Albany County and businesses that have stepped up to look at the way they're operating, to change the way they're operating, but obviously being part of the solution, not part of the problem. And this is really going to help us, like you said, not just in the town of Guilderland, but in the town of New Scotland and part of Schenectady County, which we have a great partnership going on with Tony Jaginski and them and their legislature working together in conjunction, because it is the capital region. We're all one big family here, and it's only going to happen working together. But another great doctor, I got to be nice to both of you because I got two doctors on the left and right, but Liza Whalen, to her and her team, everything you're doing, thank you. But Dr. Whalen.
Thank you, and thank you so much to Dr. Halpert for his efforts. We've talked so much about the importance of testing, and testing is really the cornerstone in being able to control the spread of COVID in the community. Without testing, we are not able to do our job at the health department, which of course is to ensure that those that test positive and those that are contacts stay at home. This is the best way we know how to control the spread of COVID-19. The increased emphasis on broader patient testing is a welcome development. So now we are looking at testing asymptomatic contacts. We are looking at testing those who are under mandatory and precautionary quarantine. We are looking at testing healthcare workers and those that work in very high-risk environments like nursing homes so they can be reassured. As I said yesterday, it's important for people to go early to get testing, not to wait until they are sick, and particularly not to quote-unquote tough it out at work. This is how COVID spreads. And as Dr. Halpert says, and as we've heard from the clinicians in the community, you see a broad variety of clinical findings with COVID. Some people have very mild disease with a sore throat, headaches, we see conjunctivitis, we see diarrhea. We're learning every day more and more about clinical manifestations of COVID-19. If you work in a facility that you know COVID is present, it's a good idea to get tested. I contacted the SUNY site this morning, and they informed me that they have expanded their test criteria to fit these guidelines. These are relatively new guidelines. They came out on the 26th from the State Department of Health. So we want to ensure all those that are doing testing are aware of these broadened criteria. This is good because we have really, at the beginning of this, we had to greatly limit the amount of people we were testing because of testing capacity. Due to the efforts of County Executive McCoy, we have been able to get a large number of tests in Albany County. This is very good because as we test, we can then take actions from the contact tracing aspect of things, which is what we do at the health department. I want to clarify, we were asked to clarify again the difference between the kind of quarantine and isolation orders. Basically, if you are identified at the health department as either a case of COVID-19 or a contact of COVID-19, you fall into 3 order criteria or categories. So if you have COVID-19, and I know we talked about this and a lot of people are still interchanging the words isolation and quarantine. From an epidemiologic perspective, isolation refers to keeping people who are ill in a controlled environment so they don't spread to others. Quarantine refers to keeping people that have been exposed and could be in their incubation period in control so that if they do develop signs and symptoms of the disease, they don't spread it to others. So from us, if you have COVID-19, you will be placed on mandatory isolation. So a mandatory isolation means you have either been diagnosed with COVID, or you may be ill and waiting for a test to come back. In this situation, we reach out to you, we monitor you for symptoms, we ensure that the needs that you may have at home in terms of supportive services like food or picking up prescriptions from the drugstore, et cetera, that those needs are met. We ask about other needs that we can certainly address, and that includes staying home until you are symptom-free, and we monitor you for symptoms like cough and fever while you are on mandatory isolation. Those that have close contact with a known case of COVID-19 are placed on mandatory quarantine. So mandatory quarantine, again, you're asymptomatic, you are well, but you have had known contact with a case that's been diagnosed. So this may mean you live with someone or you work in an environment where you have been about 6 feet apart from this individual for a prolonged period of time, and prolonged period of time usually means about 10 minutes. So in that situation, you are issued an order of mandatory quarantine and followed along for 14 days. If you become symptomatic during that time period, you may be tested and then placed on mandatory isolation if your test comes back positive. Precautionary quarantine refers to individuals who have what's called proximate contact. So this is situations in which, for an example, someone may have been at a local supermarket or, before schools were closed, where we can't clearly identify people that may have been close, but we know that they might have been in the same room, or they have had, interactions that are a little less defined. As the pandemic has evolved, our numbers for precautionary quarantine have dropped significantly because we are not congregating in spaces where people would be expected to be exposed in this way, like we were before the economy and schools and places of businesses were closed down, and before people were wearing masks. So our numbers for precautionary quarantine are much less than our numbers of mandatory quarantine. And those precautionary cases we also follow along. The difference between how we follow mandatory and precautionary quarantine at the health department, if you are under mandatory quarantine, you are followed twice a day. So that includes a telephone contact, and it also includes a home visit to ensure that you are adhering to your quarantine. If you are on isolation, you also get a home visit. If you are on precautionary quarantine, the contact is via phone call. Again, there's much less of this. And, in Albany County, to date, we are able to do a lot more than other counties because of the infrastructure that we have, because of the dedication of the staff who are working many additional hours, and because of the resources that have been made available to us from other departments through the county and through our Medical Reserve Corps. We have a number of very dedicated individuals who are coming to us on a daily basis, working at the health department and assisting with this very important work. It really does take an army of people to do this. Again, if you can, think of everyone that we contact. We have to determine who they've contacted. So often there are families, workplaces, others, and it can run quickly into, tens of contacts per individual. This again circles back to the importance that we continue to assert for social distancing and for staying at home and for wearing a mask when you're out and about. We want you, if we have to contact you, we are hopeful that the only people that you have been in contact with are people that you live at home with on a daily basis. We really need to be mindful of how we protect ourselves in any environments outside of our homes, so that we are meticulous with wearing masks and with performing frequent hand hygiene, so that we can continue to prevent the spread of COVID in the community.
Thank you, Dr. Whalen. As always, anyone that wants to go to the Priority 1 Urgent Care in Guilderland, the number to call to is area code 518-867-8040, 867-8040. Just wanted to put that out there.
Thank you.
And then, again, when we had Tom Narachi on Sunday in the Chamber of Bethlehem on here, some of the things we talked about was the payroll protection program with loan applications reopening yesterday through Small Business Administration. I got the website up so people can see that. I encourage you to do that. If you have an issue, the small businesses that might be struggling, don't know how to fill it out, please work out to the chambers, reach out to people in your community that can help you fill that out. It's very, very important. There's a lot of benefits that came through this last stimulus package that can help you to reopen up your doors, and that's what we want to do here in Albany County. Make sure we protect the people that have been in business for a while, and to make sure that they can reopen up their doors and take care of their workers as they've always have been. So keep that in mind. I also just want to say one thing. I forgot to mention this earlier. I want to say thank you to Supervisor Peter Barber and the county legislators out there in Guilderland that obviously want to get testing up and running in their community. So thank you for helping us with everything. I can't thank you enough. And again, I can't stress enough, we got that mental health line that anyone can call 7 days a week, 8 a.m. to 8 p.m. and area code 518-269-6634. Please call if you have any issues, concerns, or just want to get clarification on something that's bothering you. That's what they're there for. And again, we have the 211 number in the New York State hotline. Thank you to everyone out there that has been making a difference in our community, and for everyone that's keeping us moving. So thank you again.